Well, good evening. Kirk Euler back with you. Hey, I've got disturbing news. Yesterday, our Board of Supervisors met. We had another update from our public health officer about what's happening in Placer County. And what I learned is two things that are very disturbing. First, based on the governor's completely faulty metrics that actually have no relationship to our true public health in our county, it looks like we might have to start shutting some of our businesses again. Number two, what I learned is that the numbers that we are being reported are completely bogus. They are meaningless. They are worthless. From a public health, public policy standpoint, the infection rates, hospitalization rates, numbers of people in the hospital overall, as opposed to just percentages and all that, worthless. Because yesterday in our Board of Supervisors meeting, our public health officer, Dr. Sisson, for the first time, we've been doing this for 4 months now, talking about this. For the first time yesterday, after I asked a series of questions, it finally came clear what the game is. Today, every number that you hear, hospitalization, death, all that, there is no distinction whatsoever between patients admitted to the hospital with COVID versus patients admitted to the hospital because of COVID. Not a single county in the state, perhaps, I don't know if all states are doing it this way, but perhaps not a single state in this nation can tell you they know how many people are hospitalized, in the intensive care unit, or dead because of COVID as opposed to with COVID. What do I mean by that? Well, let's just say I'm practicing my chainsaw juggling and I sneeze and something goes wrong, and next thing I know I'm being wheeled into the emergency room to have a limb reattached. And as I'm being wheeled in, somebody shoves a Q-tip down my throat, and 3 days later that comes back positive. I've already got my limb reattached. I'm already back home resting and thinking about what I did wrong with my chainsaw juggling. But my hospitalization, because that test came back positive, is now counted as a COVID hospitalization. I had no symptoms, didn't know I was sick. Might have already been sick and had the antibodies. And my hospitalization is a COVID hospitalization. Not a chainsaw hospitalization, no, a COVID hospitalization. So when you look at the numbers, what you need to know is there's not a single number that relates to hospitalizations, ICU, or death that anybody can say we have that many deaths because of the disease. They're claiming that with the disease is as good as because of the disease. And under the CARES Act, there's a provision that allows for presumed cases. Because somebody had symptoms, we might not have gotten a test, but they had the symptoms that were COVID-like symptoms, and so we can count them as a COVID hospitalization or a COVID death because we presume it absent an affirmative test. How do you make public policy like that? Why does a positivity rate even matter? Why do we even talk about positivity rates if there's no correlation whatsoever between positivity and hospitalizations? Because unless we know that the hospitalization is driven by the disease, because of the disease, the hospitalization happened, as opposed to with the disease, the hospitalization happened. If we don't know it's because of, then we have no idea what an increasing positivity rate means in terms of anticipated stays in the hospital or in the ICU or even deaths. We have no way of correlating them. Something else that I learned that's equally disturbing and very interesting. We are being put on the watch list one of the reasons is because our hospitalization rate has dramatically increased over the last 2 weeks. And that's true. We went from about 7 people in the hospital up to yesterday, 28 people in the hospital. But you know what I learned yesterday? I learned yesterday that Placer County only has 13 Placer County residents that are hospitalized somewhere, not necessarily in Placer County, 13 Placer County residents that are hospitalized somewhere with the disease. Now wait a minute. We're being placed on a watch list because we went from an average of about 7 to now up to 28 people in the hospital, seeing that dramatic increase, and yet at least 15 of those people, aren't even Placer County residents. So we have to shut down our business. We have to change our way of life because over half of the people in our hospital likely contracted the disease in a different county. And we've got to change everything here in Placer County because of that? What kind of jacked up public policy is that? So, until they actually change the numbers, they actually change the metrics, and they actually start defining hospitalizations because of COVID, ICU because of COVID, death because of COVID, the rest of it is junk and it's worthless. And Governor Newsom, you know it. You are complicit in this sham that you are running on the residents of California, and you want to make my county residents pay for it.